Hey there. Feeling tired all the time, low on energy, not quite yourself lately? Maybe you've noticed a drop in motivation, muscle mass, or even your libido. You're not alone. A lot of men start to feel this way as they get older, and for some, the cause just might be low testosterone. Today, we're diving into something that's generating a lot of interest: testosterone replacement therapy, or TRT. Is it a game changer or a gamble? Who really needs it? What are the benefits? What are the risks? Stick around because we're covering everything you need to know. Testosterone is the primary male sex hormone, and it's involved in way more than just reproduction. It helps regulate things like muscle growth, bone density, fat distribution, red blood cell production, mood and mental focus, and sex drive. Now, testosterone levels naturally decline with age, about 1% per year after age 30. But when those levels fall too low, that's when symptoms can show up. And that's what we call low T. TRT stands for testosterone replacement therapy. It's exactly what it sounds like, replacing the testosterone your body is no longer making in sufficient amounts. This can be done through injections, which really are the most common, gels or creams, patches, and pellets implanted under the skin. The goal is to bring testosterone levels back into a normal range and restore quality of life. Now let's talk about the upside. When prescribed correctly and monitored properly, TRT can deliver some life changing benefits. Some of these include increased energy levels. Many men report feeling more alert and motivated within weeks. Improved mood and mental clarity. TRT may help reduce symptoms of depression or irritability. Better muscle mass and strength. Combined with exercise, TRT helps build and retain lean muscle. Higher libido and improves sexual function. This is often one of the first things patients notice. And stronger bones. Testosterone supports bone density, which is important as we age. I've had patients tell me TRT made them feel 10 years younger. But hold on, it's not all sunshine and six packs. Now, let's talk about the other side of the coin: the risks. TRT isn't without side effects, and it's not for everyone. Side effects include increased red blood cell counts. This can thicken the blood, raising the risk of blood clots. It can cause acne or oily skin, especially in younger men. Testicular shrinkage, because your body stops making its own testosterone. Fertility issues. TRT can decrease sperm production. It can cause worsening of sleep apnea. And prostate health concerns. There's ongoing research here, but men with prostate cancer should not use TRT. That's why it's absolutely critical to get evaluated, work with a knowledgeable provider, and get regular blood work. So, should you consider testosterone therapy? Maybe, but here's definitely who should talk to their doctor. First, men with confirmed low T levels and symptoms. Next, men with significant fatigue, low libido, or depression not explained by other causes. And men struggling with muscle loss despite working out and eating well. What's not a good reason? Well, taking TRT just to bulk up for bodybuilding or to gain an edge in sports, that's where the risks outweigh the benefits. And in some cases, it's even illegal. Not ready for TRT? That's okay. Here are a few things you can do to naturally support your testosterone. Lift weights and do resistance training. Get quality sleep. 7 to 9 hours really is crucial. Reduce stress. Cortisol competes with testosterone. Eat healthy fats like avocados, olive oil, nuts, and optimize vitamin D and zinc. Low levels have been linked to low T. Sometimes lifestyle changes can make a bigger difference than you think. Here's the bottom line. TRT can be life changing, but it's not a one size fits all solution. It should be approached with care, under medical supervision, and with realistic expectations. If you're experiencing symptoms, talk to your healthcare provider. Get your testosterone levels checked. And if you do choose TRT, do it the right way, with a plan, with lab work, and with a long term view. If you found this helpful, give it a like, drop a comment, and don't forget to subscribe for more pharmacist approved help insights. Stay healthy, stay informed, and I'll see you in the next video.